Hello, Dr. Deepthi, fertility consultant at GarbhaGudi IVF Center. Today we are going to be talking about age and infertility. What is infertility? Infertility is the inability to get pregnant after 12 months of unprotected sexual intercourse. The incidence is around 10 to 15% and it is increasing due to various factors, one of which is increased age at marriage, that is late marriages, and delayed planning of pregnancy. So age is a non-modifiable risk factor. What do we mean by this? Age cannot be reversed, neither can it be stopped. Delayed childbearing is a major challenge to us in reproductive medicine, as increasing age negatively impacts the chances of successful pregnancy, both in natural conception and in assisted conception. So we see there's an alarming lack of knowledge about the impact of age and on fertility, even among the educated population. What we see is that we see some celebrities getting pregnant over the age of 40. We see our Western counterparts getting pregnant really late, and we tend to think that we also have a lot of time. But a huge study that has been done on Southeast Asian women, which includes Indians as well, showed that Indian women age much faster. Age, here when I say age, I mean ovarian age. Our ovarian age is almost 6 years ahead of our Western counterparts. So we do have to take this into account while planning our pregnancies. We have seen that around 85% of the women under the age of 30 conceive within the period of 1 year. Whereas this percentage keeps decreasing with increased age, and it is only about 60% over the age of 35. And it decreases even further as a woman reaches 40 years of age. What is the reason for this? Just as we physically age, our ovaries also undergo aging, and within the ovaries, whatever eggs and follicles we have also undergo aging. They decrease in both number and quality. All women are born with a fixed ovarian reserve, a fixed number of eggs, and as it keeps depleting with age, there is not much we can do to increase this or to reverse this. So pregnancy planning becomes extremely important, and the age at which to conceive also becomes extremely important. We get asked if there is a best age to conceive. While there is not one particular number that we can pinpoint, we can say that 20s and your early 30s are the best age to plan conception and also have the most successful chance of pregnancies. And also due to ovarian aging, as age increases, we see that even with successful pregnancies, there are more chances of miscarriage. All this while we've been talking about age and infertility, I've only talked about the impact of women's age. So the question is whether male's age also plays a role. Is male's age important? We do know that males do produce a fresh batch of sperms every 2.5 to 3 months and continue to do so throughout life. But beyond the age of 40 years, we've seen that the amount of DNA damage or the amount of genetic abnormalities that we see in the male sperm also increases. So while there is no particular fixed age, it is advisable for males also to plan their plan a child before they turn 40 years of age. So we've seen that as a consequence of delayed planning and delayed childbearing, not just the journey of getting pregnant, but the journey of childbirth once you get pregnant also becomes difficult. What is the solution to this? As we know, we cannot reverse age. All that we can do is plan our pregnancy ahead. Take a consultation. There are very simple tests to determine whether we have the adequate number of eggs and whether we have a time to plan our pregnancy. Get a basic ultrasound scan and a simple hormonal test called the AMH, which will give us a rough idea of the ovarian reserve. And for males, a basic semen analysis would be sufficient. All these combined will give us a rough estimate and we will be able to guide you better about your pregnancy planning. So all the best for your pregnancy journey. Do consult an expert, and if due to some unavoidable reason you have to postpone your pregnancy, there are options of social egg, sperm and embryo freezing available. Do contact us to know more. Please subscribe to our channel for more such information. Thank you.